Welcome back to the Neuro Health broadcast. I'm your host, Dr. Coppus, and today we are joined by our guest, Erika Niewald from Balance Integrative Wellness. She is a licensed acupuncturist here in Ohio, and that's exactly what she's coming on to talk to us today about. She gave us so much good information on what acupuncture is and what the difference is in that approach versus other healthcare, as well as kind of the far-reaching benefits of acupuncture, some of the far-reaching things that you can use acupuncture and apply it to. So if you're curious about acupuncture, Erika does a great job of kind of introducing it as a therapy so that after today, I think you're going to be able to step away with much more information on acupuncture, who it's good for, what it is, what to expect, and so on and so forth. So after a quick announcement from our sponsor, Erika Niewald with Scratching the Surface of Acupuncture. This podcast is brought to you by Delta Neuro Health, located in Columbus, Ohio, where non-invasive, personalized care is revolutionizing the way we approach complex neurological issues. With cutting-edge techniques in functional neurology, functional medicine, and chiropractic care, we're leading the way in managing conditions like concussion, dizziness, brain fog, anxiety, POTS, attention, and more. To learn more, visit our website at deltaneurohealth.com. Welcome back to the Neuro Health broadcast. I'm your host, Dr. Joe, and today we are joined by Erika Niewald. Thank you for joining us today.
Great to be here. Thanks for having me.
And you practice out of a clinic called Balance Integrative Wellness, right? Here in Columbus?
Correct. Yes.
Awesome.
It's my practice. It's called Balance Integrative Wellness. It's located in inside Women's Integrative Medicine, OBGYN. So I'm co-located with the OBGYN office. And it's right in Westerville, right on the outskirts of Columbus.
Mm-hmm. And you practice acupuncture within that practice as well, or as well, but that's what you do.
Yes. I'm an acupuncturist. I also do cupping is available at my clinic. I do Reiki and aromatherapy as well as I help teach people guided meditation or breath work if they want to have some practices to try at home. So I do a lot of different things and teaching for my patients.
Awesome. So I know just from talking to you previously and then talking to you today, we're gonna have a lot of cool things to talk about, such as acupuncture during pregnancy and maybe after, because that's one of your main focuses. But then we'll also get into a little bit of neuroacupuncture as well, which I'm very fascinated in as well. So, before we get too deep into those topics, could you just let our listeners know a little bit about yourself and why you got interested in this career path in the
Sure,
first place?
absolutely.
Hmm.
So I have kind of a long history of different things in my career. I was in the Air Force for 20 years. Um, I spent that time doing a completely non-medical career field. And when I retired after 20 years, I decided I wanted to go into healthcare. And I kind of learned several different things, which is why I have so many different things in my background that I can offer to patients. I also have a master's degree in counseling as well. Um, and I kind of landed on acupuncture as how I wanted to, start my second career. So I went to school right here in Columbus, to the American Institute of Alternative Medicine and got my master's degree in acupuncture. And I find it really just an amazing career field. I've seen some really great things happen in the short time I've been practicing with my patients. So,
Hmm. No, I can imagine. Is there anything that you personally would be able to share about your experience with acupuncture?
Sure. Well, the first time I had acupuncture personally was before I was doing training for it. And I had suffered from cluster headaches, which,
Mm,
if the listeners don't know about cluster headaches, they're kind of a very severe migraine that comes on in bouts where you get
mm,
several a day. They often come on in the middle of the night and wake you up. It's kind of a one-sided, similar to migraine pain,
mhm,
and they're really debilitating. Like, you cannot focus very well when you have one. You kind of, sorry, my
you're good.
printer just made some noise. I apologize. It's very hard to focus when you have the headache. So one of my doctors, I was going to a neurologist and they were just trying different medication after different medication. And, well, that's not really working. Let's try this. And it seemed kind of, you know, just let's try this. And
Hmm.
so one of my coworkers had said, have you ever tried acupuncture for this? This might be something, that might help you.
Hmm.
And I was thinking, I don't know, sure about acupuncture, but I thought, I am so frustrated and I was exhausted because I wasn't sleeping well. And this had lasted like 2 months at this point. So I thought, I'll try it. I'll just give it a shot. And so
Hmm.
I went to acupuncture, and after the first treatment, I slept through the next 2 nights, and that hadn't happened in about
Hmm.
2 months. So I was just super thankful. And then it kind of came back. So I went to several more treatments, and it really helped end the cluster of
Hmm.
headaches and kind of dissipate that for me. So that's when I really started to try to learn more about acupuncture, and
Hmm.
where I got interested in it.
Yeah, that's amazing. And cluster headaches are you summarized it very well, but I mean they are so debilitating and so hard to manage. And just the fact that, acupuncture was able to do so much for you, I mean, that is huge. That is huge. Have you been able to work with many cluster headaches since then?
No, actually, I've never had a patient with cluster headaches.
Hmm.
I did have one patient who had just a really severe chronic migraine condition, and she had some level of a migraine every day for about 10 years. And when she came in, she was just kind of at her wit's end. She was trying to go to school, she was trying to do all these things. So we just did one treatment, and then she didn't come back. And I kind of thought, oh, this is sad. I guess it didn't help her. But about 6 weeks later, she did make another appointment. And when she came in, she was just like crying with tears of joy. And she said, I haven't had a headache in 6 weeks.
Hmm.
I didn't come back because they were gone. And I just, felt so much better. And she said, but the other day I kind of felt a little bit of pain. So I decided I'll come back. And
Yeah.
so that for her was a huge change in her life. She was a nurse. She was trying to treat patients, and she was just going through life with this continuous headache, migraine.
Yeah.
And so for her, that was really a big change, which
Yeah.
that's why I got into the profession. I wanted to be able to help people. So really satisfying to follow her story. And she still comes here and there.
Hmm.
Her headaches are mostly gone at this point, but she'll come in just for, like, she calls it like a tune up, and just to kind of remain healthy and keep her body balanced.
Hmm.
So,
That's amazing. I mean, that's incredible. I mean, now she's able to give back more fully because she's in the healthcare world as well. And I find that, so many practitioners like yourself have personal positive experience with what they're doing. And then you can translate that and then just repay it tenfold back into the community. I think that's fantastic.
yeah, it really is. I love it. It's really great.
Yeah. For our listeners who I'm sure have heard of acupuncture,
Mhm.
right? But they may not get the ins and outs of what acupuncture is or, what it's purporting to do. Can you kind of just educate us high level on what it is you're looking for, what it is you're aiming to do, and what do you expect when you're working with patients?
Sure, absolutely. So a lot of people consider acupuncture when they have a pain condition. And that's where most people kind of associate, oh, I have some pain. Maybe acupuncture might help. But really, acupuncture is this amazing modality that can help with so many different areas of health or unhealth. Um, and it's based in Chinese medicine theory. And so the terminology we use, the way we think about our diagnoses of patients is completely different. So it's based on things you hear related to Chinese medicine, like yin and yang.
Mm.
And there's a big focus on that balance. If you have too much yang and not enough yin, that's dishealth. You're not. You don't have balance in your body, disharmony. So it's similar to Western medicine, kind of looks at the same thing like homeostasis. Our body wants to heal itself, it wants to stay balanced. So homeostasis is how our chemical systems and all of our body systems physiologically work. So in acupuncture, we just, it's in terminology of yin and yang, heat and cold,
Mhm.
just different factors that balance each other out. We also look at different organ systems. So I have my little acupuncture guy here. We have a system of meridians. So all these lines you see on him, on his front and on his back, are different meridians. And the meridians are named after the organs of the body. So Chinese medicine thinks of the organs a little bit differently. You know, they all have a job in our physiology. And the job isn't necessarily the same job that Western medicine knows scientifically that organ does, but it's related to emotion, it's related to balance. It can be related to something that in Western medicine it wouldn't necessarily be related to. So it's really hard to kind of translate and explain sometimes. So when you talk about chi and blood and, liver stagnation and different things, people kind of go, there's a problem with my liver. No, it's liver chi stagnation. It's just a different kind of diagnosis.
Mm.
But what's really fascinating with it is that um, there can be a disease that we would diagnose in Chinese medicine that in Western medicine, maybe it would be 5 different things, but in Chinese medicine, it pulls all those things together. And it's actually one thing that we can treat. So, for example, if we have someone that comes in and they have headaches and they have tinnitus, maybe they have some weird anger issues that they're not sure why they're having those. And they're also constipated. You can kind of look at those things like, oh, they have a problem with their ears, they have headaches, they have a digestive problem, and they have an anger issue. So, maybe they need a psychologist, maybe they need a gastroenterologist, perhaps they need a neurologist, and maybe an audiologist for their ears. But in Chinese medicine, we can look at that and say, oh, that's liver fire. And we have a treatment that covers all those things. On the opposite side of that, there's some things like a cough. If someone comes in with a cough for Western medicine, they kind of look at, is it viral? Is it bacterial? Can we treat it? Will it just run its course? But a cough could be many different things in Chinese medicine. So we ask more questions and are thorough about other things going on to kind of determine which type of cough it actually is and treat it appropriately for that disease. So it's really interesting how some things in Western medicine and Chinese medicine do overlap, but some things expand and some things kind of contract. So it's kind of a neat um, really interesting modality. But the basis is the whole person. So when we do an intake, we will look at the whole person. If you're coming in for headaches, we're not just going to ask about the headaches. We're going to ask about your digestion, how much water you drink, a whole myriad of different things
Mhm.
to try to determine the best treatment.
Right. Yeah, it's not a one size fits all approach. It sounds like, yeah, you're really
Yeah.
taking everybody into consideration.
Yeah. And so someone that comes in for migraines one day, based on all the other symptoms or how they live their life, their environment, their stress at work, their family life. could be completely different from the person that comes in with migraines the next day, just based on all those other factors. So it's really fascinating.
Yeah, especially migraine, which have so many
Yeah,
factors to
it's so much.
exactly. One thing that has been gaining in popularity, I would say, in maybe Western medicine is dry needling, right? A lot of PTs, maybe some chiropractors do dry needling. Can you talk to, how that is not the same as acupuncture and why that is not the same?
Yeah, absolutely. Um, So dry needling uses acupuncture needles. They're people who are doing dry needling are doing the exact same, using the exact same tools. However, they are more focused on, um, they've learned a physiological Western medicine type of needling that focuses kind of more on trigger points. So the same as, a massage therapist or an osteopathic physician would potentially find a trigger point, or a chiropractor, and work on getting that trigger point out. They're putting a needle in that spot that is a trigger for whatever the muscular issue is that the person's having. In acupuncture, we do use some, not really trigger points, but tender points, and they're called Asha points. And um, sometimes we will use that as a modality. If someone just has pain in a certain area, we will surround it or put needles where the pain is. But acupuncture, beyond just those needles, has a rich theory of, you have a headache, we're going to put a needle in your hand here. And that all has a relationship. So that's where dry needling just stops at, this is a spot that hurts, let's put a needle there, or a couple needles on the muscle ends where the pain is, and see if that helps. But acupuncture has this whole, like I discussed before, this whole theory of, balance and energy and chi regulation, and just health within your body. So I
Mhm.
would say, acupuncture is a much bigger theory, not to discredit the point that dry needling can help. I've had dry needling from a physical therapist, and it did help my shoulder at that time. But now, knowing what I know, if I had my choice, I would go to an acupuncturist
Mhm.
because they can put some needles in my shoulder to help, but also, they're going to do needles in the rest of my body that will also help my shoulder. So there's just more theory, I think, behind an
Mhm.
acupuncture, someone who studied acupuncture versus um, a chiropractor, or physical therapist, or even a physician that's doing some type of medical acupuncture. So,
Yeah. So really the theory and the philosophy are the big differences. And it
mhm.
sounds like typically with trigger point therapy, it may be more spot specific, or you're just, doing things to maybe reduce pain or in the point of the problem area essentially, whereas acupuncture might be looking, holistically, how is the body moving and functioning as a whole and not just an isolated point. Is that fair?
Absolutely.
Yeah.
Yeah. And another thing to think about too, acupuncture shouldn't be very painful.
Hmm.
So I've had a couple patients come to see me, and I don't know who the practitioner was that they saw, but they said, "Oh, I'm just coming for cupping because I don't want needles. I tried that once, and it was really painful, and it didn't help me." And I kind of say, where did you get that? Who was it from? Oh, my physical therapist. And it shouldn't be painful. So if you are going to another practitioner and it causes you severe pain, then that's probably not a good treatment. And you might want to just try looking for someone who's actually licensed in acupuncture specifically, and give that a try.
Yeah.
Um, Not to discredit, the theories. There are many practitioners out there that do an amazing job
Hmm.
of dry needling or doing chiropractic acupuncture. But there are some that don't. So
Yep.
if you really want to get the full treatment with a theory behind it, and all the benefits of Chinese medicine, look for an acupuncturist.
Yeah. More of a purist there.
Yes. Yeah.
So far we've kind of established that acupuncture has been very helpful for pain. You know,
Mhm.
we've talked about a number of different cases where it's been huge for pain. Um, Something you said that you focus on primarily, though, is you work in an OBGYN based clinic. You work with pregnant women and postpartum as well.
Yes.
So what are some of the things that you're working with these women on? Is it all pain? Are there other things that we're looking to address?
There's definitely a lot of things that we're addressing.
Mhm.
Uh, it's really pretty fascinating. Um, so it kind of goes throughout, I'm working with some patients for fertility, whether they're trying to naturally get pregnant or some of them have already gotten to the point where they're trying to do IUI or IVF to get pregnant. And there's acupuncture treatments that support those processes as well as they're going through that. Um, Once someone is pregnant, there's help for nausea and vomiting, different pains that you're having during the different phases of your pregnancy. Um, there are some acupuncture points that are great for just getting the body ready to go into labor. So as some of my patients get closer to their like 38-week point, we start doing some points that support the body, boost their energy, kind of get their abdomen, their cervix, their body ready to start labor. So,
Mhm.
and then postpartum, acupuncture is really amazing for boosting energy, after the mom delivers, whether it's a cesarean section or a vaginal delivery or natural or whatever type of birth they have, they're exhausted. They need to rebuild that blood they've lost. They need to rebuild their chi, their energy. So acupuncture is great for that, as well as a lot of emotional support can be derived from acupuncture if someone's suffering with postpartum depression. um, it's a hard time, all of the focus is on you when you're pregnant. And then once you have the baby, the focus shifts and everything is about the baby. And so, it's kind of hard sometimes um, for the new moms to find their place and how do I feel and how am I doing? And so it can help with emotional balance and regulation as well. So there's really something all the way through pregnancy, from thinking about getting pregnant all the way through you have this great new baby in your life. So
Yeah. And I guess a good follow-up question would be, can babies have acupuncture, or is there a certain age that they can start?
yeah, that's a great question. We do have it's called Shoni Shin, and it is a basically acupuncture for babies and children. And it's not necessarily needles. I don't have them with me, but we have tiny little tools, and it's more of like stimulation with
Mhm.
tapping
Mhm.
or rubbing rather than sticking the needles in. The youngest patient I've ever had for acupuncture, I think, was about 12.
Mhm.
Um, you can do acupuncture on kids younger, but it just kind of depends on if they're too little, they're not going to stay still with needles. So it's just not a great idea. But we have a lot of other things that we can do, whether it's acupressure, just putting pressure on those points, or some Tui Na, which is Chinese massage therapy to help. If kids have a cough, cupping is actually a really good treatment on their
Mhm.
back for
Mhm.
a cough or just getting phlegm and getting congestion out of their lungs.
Mhm.
So there's definitely some great treatments for kids. And I can do non-needle treatments if
Great.
people want to bring their kids or babies in.
Yeah, and that's a good, also something good to, I guess, discuss is not everybody has a fondness for needles. They don't always enjoy that feeling, or they may be a little phobic of it. So it's good to hear that there are some alternatives to acupuncture care rather than always needing to go for the needle. But in your experience, do you find that the needles are the most effective route than the
Mhm.
alternative?
I do. It kind of actually depends on what the condition is. So A lot of times, I do have a lot of patients that come in just for cupping,
Hmm.
for basically muscular pain. And cupping really is a great treatment to relieve tension or stressed muscles or
Hmm.
areas just kind of tightness in your body.
Yeah.
Um, and also, I do have some different types of electrical stimulators that
Hmm.
can do points, and I can just take a kind of like a pen almost and place it on a point and
Hmm.
stimulate the acupuncture points. Or sometimes if someone has an open wound, I will take two of the pens and they have opposite polarities. So it'll run electricity between the two pens as I go down a wound, to help with healing, to help
Hmm.
boost the body's ability to heal. So it just does kind of depend. For the most part, I mean, I always recommend acupuncture for most things, but
Hmm.
sometimes I see the patient, they came for acupuncture, and I say, I think we should try cupping first because I think cupping is really going to give you the best response. Just
Hmm.
kind of depending on the person.
Yeah. Interesting. And I alluded to this in the beginning of the podcast, but one thing you can do is neuroacupuncture, or where you can actually place them on the scalp. So, can you tell us a little bit about what you might be doing there and what that's doing with the brain?
Yes, absolutely. So neuroacupuncture, or we just call it scalp acupuncture, basically. Um, it's really an interesting modality of Chinese medicine. So first, I'll say Chinese medicine is so amazing in that it's not just one, we think, oh, it's acupuncture, but there's people that have studied different areas of the body. So there's acupuncture that some people will just do on the ear. You can go to some acupuncturists who only treat your ear, or only treat your abdomen, or only treat your scalp. So scalp acupuncture has been known to help with a lot of neurological conditions.
Hmm.
And it's actually fairly new compared to acupuncture that we think of, like traditional Chinese medicine has been around for thousands of years. But scalp acupuncture was kind of developed in the 70s. There was a Chinese doctor, I think his name, I don't remember what his name is, sorry, I can't
That's okay.
remember. But anyhow, he was a neurosurgeon.
Mm.
So he was trained in Western medicine and he also knew acupuncture. And he wanted to kind of do some research and correlate, like, if I do needles on the scalp, how does it correlate to activities in the brain? And
Mhm.
so he kind of started doing this research and found that different parts of the brain helped with different neurological conditions.
Mm.
So the areas of the brain. So we learned scalp acupuncture in school. It's one of the different kind of treatments that we can do. And it's focused on motor issues, sensory issues, optical, hearing, speech issues. So there's a lot of different neurological things. And so he had discovered there are just different areas on the scalp that correlate with different parts of the brain and different brain
Mhm.
activities. And he created this map that of where you put the needles. It's actually um, it's a fairly simple map. There's not a ton of different treatments, but different areas are for different like internal organs
Mm.
or, motor, sensory. And it kind of does correlate with the parts of the brain.
Okay.
So there is some you can see if you look at the patterns of the brain, like the area for the eyes is the occipital region. And
Mhm.
so that correlates with sight. So
So if someone had like a motor aphasia, you might put an acupuncture point on Broca's area, maybe, or
exactly. Yeah. There's three
interesting.
areas for speech, and one is related to Broca's, one is related to Wernicke's, and then another is a more general speech area. So yeah, it's definitely related. And so it is kind of it's incorporates traditional Chinese medicine, but also Western medicine and
Hmm.
just the ideals of neurology. So
That's fascinating. Yeah, I would love to tag team and just have you doing your acupuncture, maybe neuroacupuncture. I can imagine or envision maybe a stroke patient, who lost motor ability of one side of their body or their hand maybe. And then you're doing your neuroacupuncture, and then me doing my neuro based exercises to really give that person a profound experience and just great therapeutic chance for success. So yeah.
There's a lot of research actually, and I just remembered his name's Dr. Zhao,
Mhm.
was the kind of known as like the father of neuroacupuncture or scalp
Mhm.
acupuncture. Um, but there's a lot of research around scalp acupuncture where you do put needles in the scalp and then you have the person do more activities. So it's not, if someone comes in for an acupuncture treatment for anxiety, I'll just have them lay on the bed, put the needles in, they close their eyes, they relax for 20 to 25 minutes. But with some parts of scalp acupuncture, depending on what they're coming in for, you want them to move around as they
Mhm.
have the needles in to
Right,
see what the changes are.
right. Yeah, I can see, a lot of cool pairing activities that you do, acupuncture, maybe even add in some photobiomodulation or laser therapy as well. And just, yeah, that's
Absolutely.
so great. That's
Yeah.
so great. But Erica, we are pushing up on the end of our time.
Okay.
So I wanted to just make sure that we had enough time for you to convey to the audience how they can find you, more about what you do, where you practice, and that sort of thing.
Sure, absolutely. So my office is located inside Women's Integrative Medicine, OBGYN. It is located in the medical office buildings next to Mount Carmel St. Anne's in Westerville. You can find me, my website is www.balance, BALANCE dash for dash wellness.com. And on that website, you can just schedule right there. You can learn about all the different practices that I do, and there's a lot of different options of what schedules you can do. If you have some questions about acupuncture or any of the modalities that I do, you can, when you go to schedule underneath the acupuncture section, you can schedule a free 15-minute phone consultation. And it's actually a video call, and you can talk about your condition. You can ask me any questions that you want before you schedule an appointment. And I can kind of tell you how I would be able to address your specific condition.
It's fantastic. I love how approachable you are with it and so accessible. So that's great. Well, I definitely learned a lot today. I know our listeners are going to get a lot out of this, so I really appreciate you coming on and sharing your knowledge with us.
It was great to be here. Thanks for having me, and I hope we can work together with some
I
patients.
I think there's a lot of potential there, so I'm excited to do so. Awesome. Awesome. Well, until next time, hopefully we'll get you on again. And but for that, until then, take care, and everyone else out there listening, take care as well.